Thalomid is used to treat or prevent certain skin conditions related to Hansen's disease, once known as leprosy, erythema nodosum leprosum. Thalidomide is also used to treat a certain type of cancer, multiple myeloma. It works in Hansen's disease by reducing swelling and redness inflammation. It also reduces the formation of blood vessels that feed tumors. Thalomid affects the immune system, which promotes immune responses to help slow tumor growth. Thalomid is also used to treat and prevent moderate to severe skin lesions caused by leprosy. How to use. Take Thalomid on an empty stomach at least 1 hour after eating a meal. Swallow the capsule well. The medicine from an open capsule can be dangerous if it gets on the skin. If this occurs, wash your hands with soap and water. Ask a doctor pharmacist how to safely handle and dispose of a broken capsule. Your doctor will need to check your progress on a regular basis. Usual dose of Thalomid for leprosy, erythema nodosum leprosum. Cutaneous erythema nodosum leprosum, initial dose 100 to 300 mg orally once a day with water, preferably at bedtime and at least 1 hour after the evening meal. Patients less than 50 kg should be started at the low end of the dose range. Initial dose up to 400 mg per day orally once a day at bedtime or in individual doses with water, at least 1 hour after meals. Usual dose of Thalomid for multiple myeloma. 200 mg orally once a day with water, preferably at bedtime and at least 1 hour after the evening meal. Thalidomide is administered in combination with dexamethasone and 28-day treatment cycles. The dexamethasone dose is 40 mg orally on day 1 through 4, 9 through 12, and 70 through 20 every 28 days. Approved indication in combination with dexamethasone for the treatment of patients with newly diagnosed multiple myeloma. Usual pediatric dose of Thalomid for leprosy, erythema nodosum leprosum, 12 years or older, cutaneous erythema nodosum leprosum, initial dose 100 to 300 mg orally once a day with water, preferably at bedtime and at least 1 hour after the evening meal. Patients less than 50 kg should be started at the low end of the dosage range. Severe cutaneous anal reaction are patients previously requiring high doses to control this reaction. Initial dose up to 400 mg per day orally once a day at bedtime or in divided doses with water, at least 1 hour after meals. Contraindications. You shouldn't use Thalomid if you are allergic to Thalidomide. Thalidomide can cause severe life-threatening birth defects or death of a baby if the mother or the father is taking this medicine at the time of contraception or during pregnancy. Even 1 dose of Thalidomide can cause major birth defects of the baby's arms and legs, bones, ears, eyes, face, and head. Never use of Thalidomide if you are pregnant. Tell doctor right away if your period is late while taking Thalomid. To make sure Thalomid is safe for you, tell doctor if you have ever had heart disease, a stroke, or a blood clot, a seizure, if you need surgery, or if you also use pembrolizumab. You should not breastfeed while using Thalidomide. Precautions. You must not donate blood or sperm while you are using Thalomid and for at least 4 weeks after your last dose. Avoid exposing another person to blood or semen through casual or sexual contact. If you're driving or hazardous activity, tell now how this medicine will affect you. Reactions can be impaired. Avoid getting up too fast from a sitting or lying position or you may feel dizzy. Drinking alcohol can increase certain side effects of Thalomid. This medicine can pass into body fluids, urine, feces, vomit. Thalomid side effects. Get emergency medical help if you have signs of an allergic reaction to Thalomid, hives, difficult breathing, swelling of a face or throat, or severe skin reaction. Fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Seek medical treatment if you have a serious drug reaction that can affect many parts of the body. Symptoms may include skin rash, fever, swelling glands, muscle aches, severe weakness, unusual bruising, or yellowing of your skin or eyes. Call a doctor at once if you have numbness, tingling, or burning pain in your hands or feet. Slow heartbeat, shallow breathing, severe dizziness, feeling like you might pass out. A seizure, convulsions, severe or ongoing constipation, signs of bleeding, easy bruising, nosebleeds, bleeding gums, bloody or artery stools, coughing up blood or vomit that looks like coffee grounds. Signs of a stroke or blood clot, sudden numbness or weakness, problems with vision or speech, chest pain, shortness of breath, swelling or redness in the arm or leg. Heart attack symptoms, chest pain spreading to a jaw or shoulder, nausea, sweating, low blood cell counts, fever, chills, flu-like symptoms, swollen gums, mouth sores, skin sores. Signs of tumor cell breakdown, confusion, weakness, muscle cramps, nausea, vomiting, fast or slow heart rate, decreased urination, tingling in the hands and feet or around the mouth.